All right, now to some pretty incredible news coming from the cancer prevention world. Swiss scientists have developed an implant that can detect cancer in a person's body.
Yeah, joining us now to talk more about this incredible device. It has huge potential to offer early warning signs. Dr. Sabrina Fabi, thank you so much for being here, first of all.
Thanks for having me, guys.
Okay, this sounds absolutely incredible. It's an implant. How does it work?
Right, so it's basically a network of little cells that are going to be placed underneath the skin, and they essentially detect calcium levels, which is basically what's excreted or released when you start to have tumor cells in your body. And so certain cancers start to increase the calcium levels in the blood. This particular network of cells will detect those calcium levels, and upon recognizing that, it will start to basically deliver melanin, which is the pigment that creates the color of our skin. It starts to basically create a little pigment patch, which basically looks like a mole, which would tell us that perhaps there might be some type of cancer brewing.
So tell us who would get this. Is this something that everybody should have in their body ultimately to know if there's some sort of cancerous growth, or is it something like somebody has had cancer and they want to prevent it from coming back?
I think with the future of where we're going, right now presently cancer, basically all of us have a 1 in 3 chance of developing cancer, and our risk of dying from cancer is 1 in 5, both men and women. And there's supposed to be an increase of about 50% new cases of cancer increasing by 2030. So with this surge in cancer and knowing and recognizing that this is a disease that if you catch early, that you can pretty much live from the disease, then really all efforts are going to prevention versus actually treating if possible. So in an ideal world, everyone, right? But the limitation of this device is that it's really only detecting certain types of cancers presently. So presently it's detecting more prostate cancer, breast cancer, colon cancer, and lung, which are the most common forms of cancer, so this is great. But in an ideal world, we'd be able to detect all kinds of cancer and even other conditions like Alzheimer's or heart disease.
So it actually monitors the calcium, so that's vitamin D in your system, is that right?
Right, so calcium is, you need both calcium and vitamin D to make bone, but calcium is something that we generally do have in our body to help us create bone.
And it's elevated when it detects some form of cancer. So what happens, like if let's say I have it I have this implant, what do I do if it's telling me that there's something wrong?
So basically, you start developing a little mole in an area, then you'd go to your doctor so that they can essentially screen you for those particular types of cancers and detect them early. What they have found is that it may actually detect it before our standard types of tests, which are CT or even ultrasound exams, may even recognize it. So there might be a little gap there that they are going to have to bridge in the decade that they anticipate it's going to take for this to become medically available.
Yes, that was actually my next question. Where are we in the process? They've developed this. Who do they test it on next? Is it animals, then humans? And ultimately, is there going to be the fear of they're implanting what in me, and what is it doing to my body or knowing about me now?
Right, because everything has risks, right? So if you do anything, I always tell my patients there's always a risk. So with this right now, they've only tested it on human cells. They've also tested it on pig skin and in mice, and it's been favorable and tested great in all of those. So the next step is probably to do more animal testing and then move on to human testing. But there's always ethical considerations when you're putting something on someone and not others that may be able to save the lives of some and not others. So they're anticipating that presently it may take about a decade before it actually becomes available. As far as other things that we have to consider is that not all humans may want to have something implanted in them, and you have this constant paranoia and fear and looking at your skin that it might be telling you they have cancer and you really don't. And so now they're even considering doing testing on something that you may only detect under a red light or under some type of light that your doctor may have, so that you don't have to be constantly monitoring yourself and scaring yourself.
Interesting. Yeah, let's see where this goes. I can imagine a lot of people saying, well, prevention, I want it, but we'll see. All right, Dr. Fabi, thank you so much.
Thanks for having me, Nisha. Thank you.